Hello, Success Nation. Dr. Erwin here. I have high performance, great habits to lead a happy and successful life. This is going to be a niche video where I talk about my experience of pediatric from a GP registrar perspective. Having a placement in pediatric is very relevant as a GP trainee because there's rarely any day where you won't see children who present to the surgery and you have to manage them. So having a placement where you're able to acquire the knowledge and skills to manage these children in primary care is important. Many trainees have anxiety and fears about starting a post in pediatric. Let me tell you that pediatric departments don't expect a lot from the GP trainees when they first start. However, you will be expected to assess a child safely and assess them thoroughly when you first start and seek help as needed. So there's always help at hand in pediatric department from the senior doctors. So there will be help from your registrar and the consultant is always accessible. So don't be worried about not being able to get help because that's the norm in pediatric. Common things that will present when you first see children in pediatric department are UTI, abdominal pain, asthma, wheeze, seizures. So recommend that you read these topics because these are common presentations and you will see these presentations. So being able to know how to manage these problems are important. The other thing about pediatric is that you will elicit the history mainly from the parents or the carers. So it's a different history taking than adults. What you'll find that there are three key points that you'll need to cover in your history taking on top of the basic history. And this is your developmental history, your birth history, and the social history, where you take a history of the family history, where there's any medical problems in the families. And immunization is a very big topic that you need to cover in the history because you need to know whether the child is immunized or not. If the child is not immunized, what's the reason for that? Because it can lead to other problems that you need to be aware of. So being able to manage a child is very important. So you have to assess the child, and assessing a child by examination is also important. Something that I would advise is use observation because you pick up a lot of cues from just observing a child to know whether the child looks well or unwell, whether the child looks like they're dehydrated or not. So just by observing, you pick up so many cues in your assessment. And then when you come to actually physically examining the child, then you may use distraction to help you to approach and auscultate or palpate the child. So it's important to have distraction at hand. And some pediatricians, they use toys, others use a light that's going to help distract the child. And use a parent to help you in your examination. And then you also may have to do some venipunctures or cannulation when it comes to managing a child. And in the beginning, you're not expected to do this because it's different from adults because you have to hold a child and it's better to see first before you actually do it. And you also have play therapists who can help you in distracting the child. But the principle is the same as you would cannulate or do a venipuncture on an adult. It's just the way you do it. You need to consider that a child might move and they might start crying. So always have somebody at hand with you when you're doing any of these procedures. You'll find that as you do more and you get the skills and confidence to do it. So it's not difficult, but you just need to practice. And when you first start, you'll practice under supervision. And once you've seen a child and made your management plan, it's always advisable to discuss it with a senior doctor because the child has been referred to the department. And as a GP trainee, it's best to get the opinion of the pediatrician. And some of the experience you find that it's quite straightforward, but there are things that you may not pick up when you first start. So that's why it's advisable to always discuss any case with a senior pediatrician. The other thing is that you'll also speak to GPs who are referring children, and you'll find that it's different dynamic when you're at the receiving end of being a secondary care hospital, because in secondary care you have more luxury of time and you're able to observe a child over a few hours. And when a GP sees a child in a surgery, they only have 10 minutes. And sometimes when you see this evolution of the care of the child and how they develop, you'll see that there's some of the child who have been referred, they can be discharged from pediatric assessment unit, others may need to be admitted. And the other thing is, when GPs refer to the pediatric department, it's always important to know how well or how sick the child is, because in some cases the child may need to go to A&E, children's A&E, before going to pediatric assessment unit, because they need to be stabilized first and then they can come to the pediatric assessment unit. So these are the things that you will encounter in your pediatric post. I hope you find this video useful. Let me know if you have any questions or any suggestions, and all the best in your pediatric post. Take care, everybody. Bye-bye. If you enjoy watching this video, please consider subscribing to my channel by clicking here.